the most prevalent two ways that clinical trials help people who are virally suppressed when they're living with HIV are long-acting injectables. And what is that? If I'm living with HIV, no longer do I have to take a medicine every single day in order to keep the virus suppressed, which is important because HIV is a virus that will mutate if the drug is not in the system long enough. So I don't have to worry about that every day anymore. Now, through long-acting injectables, I can take an injection every other month and it suppresses the virus. So I can go on trips. It doesn't interrupt my travel schedule, my love life, all those things that I want to do to just be me. So that's way number one. The second way is the emergence of what we call dual therapy. HIV drugs have gone from medicines that have a lot of side effects to what we call a cocktail with a lot of medicines with a lot of side effects. Now to dual therapy, two drugs in some cases, with minimal side effects. Breakthroughs that have positively impacted people living with HIV who are virally suppressed are the emergence of awareness that we need to include minoritized people in research. I'm thinking of a specific example where I had a lot of patients that were taking a new therapy. It's one pill a day, which is great, right? But then low side effects listed in research, but my patients kept saying, Dr. Green, my stomach is hurting. I had GI or gastrointestinal issues. I cannot take this medicine. So I compared it to the research and it wasn't there. I began then to ask the company to research again. And after asking them, we found out that drug did impact African Americans with abdominal issues or GI issues more than other populations. So there's a breakthrough where the research industry understood more about the need to expand research, and my patients got a chance to say, hey, here's the importance that I play in research. Here's where I'm needed so that myself and anyone in my community impacted by HIV has better outcomes.
If we think about better outcomes for virally suppressed people, we also think about, diversity within clinical trials. How can we create more diverse populations so that when we see multiple side effects, it's not after a drug is FDA approved, it's
Right.
before the drug is FDA approved, so that providers like yourself who may not be as acute to the medication and acute to the problems that their patients are having, have more of an opportunity to say, okay, this is something that I need to look for within my patient population. I never allow anyone to participate in the clinical trial and they haven't talked to their regular PCP or their provider or their doc that they go to, because they know your health the best and they know whether or not you're a great candidate for a research study from a scientific and a medical standpoint. So you definitely want them to weigh in. I also like to encourage providers to seek out clinical trials for their patients, seek out resources, have a referral system in place with other providers, clinics, or hospitals that are doing the research so that if you have a candidate or you have a patient, then you can send that patient there safely. You know that that patient will be able to feel safe and they will be able to enroll in a clinical trial and withdraw at any time if they feel that they don't want to participate anymore.
And as a provider, I found a lot of success in support of patients by making myself available to the research team and closing that a silo that historically has existed. It's like, oh, you have your healthcare here, I'm doing this, and then you're going to go over there and go to research. And what happens there isn't always. I mean, there are things that cannot be communicated for research purposes, but my patients need to get labs or come in, or if there's things in social determinants of health, like lack of transportation, and we have a bus card, that has really kind of helped and to support my patients, opening the lines of communication from the patient to the researcher to myself and back around.